Today we are going to discuss here about dermatology image-based MCQs. So guys, please watch this video before your examination. So what is the diagnosis? At least 50 image-based MCQ we are going to discuss here. So write in a comment box, what is this? I hope this is more than enough in your NEET PG 2021 examination. You are definitely going to receive some image based MCQ from this video. So this is a case of, what is this? This is a case of, this image is vitiligo. Remember, this is a case of vitiligo. Now, what is the diagnosis in this image? What is the diagnosis here? So what do you think? What kind of disorder is it? This is of erythema multiforme. Okay. What is the diagnosis of this picture? Take 30 seconds in your hands. Try to answer in a comment box. What is it? This picture represents what? What do you think about? This is a case of urticaria. Urticaria. Now, what is the diagnosis? This image in front of you. This is not a psoriasis. This is not a psoriasis. This is a case of necrobiosis lipoidica. Necrobiosis lipoidica. Okay. Now, what is the diagnosis here? In this picture, see. I'm going to zoom this picture. What is this? This is a case of, guys, if you know at least 70% marks, these all images from dermatology. So this is a psoriasis. This image shows psoriasis. Now, what is the diagnosis? What is the diagnosis here? This is a case of dermatitis herpetiformis. This is a dermatitis herpetiformis image. Okay. What is the diagnosis here? What do you think about this? The diagnosis here, actinic keratosis. This is a case of actinic keratosis. Okay. Now, what is the diagnosis? This same image they asked in NEET PG 2020 examination. So, what is it? This kind of hair loss you seen in male. So, this is a case of alopecia areata. Yeah. Ankit Tiwari. Yes, this is a case of alopecia areata. Absolutely right. Now, what is the diagnosis here? What is the diagnosis? This is in case of herpes zoster. This is herpes zoster. What is the diagnosis here? What is it? The image in front of you. Tinea corporis. This is tinea corporis. Okay. So, see this image. What is it? This is a case of allergic dermatitis, or we can say atopic dermatitis. Allergic dermatitis and atopic means same. Atopy means allergy. Okay. What is the diagnosis here? What is it? In this image you see what kind of picture? This is a case of, you see pus secretion. So this is a case of pyoderma gangrenosum. Pyoderma gangrenosum. Okay, what is it? The image shown here is, this is erysipelas. Okay, what is this diagnosis? The image shown here in 2021 NEET PG examination, you definitely going to receive one image from this, or two, three image from this. So this is a case of erythema migraines. Erythema migraines. Okay. What is the diagnosis here? What is the diagnosis here? This is a case of pityriasis versicolor. Pityriasis versicolor. Now, what is the diagnosis here? What is the diagnosis in this picture? This is a case of erythema nodosum. Erythema nodosum. Now, what is the diagnosis here in this picture? This is navy or dysplastic navy. We can say dysplastic navy. So, what is the diagnosis in this picture? You see what? Here we see cafe outlet sports. Cafe outlet sports. What is the diagnosis here? See, what is the diagnosis here? This is a case of lichen planus. This is a case of lichen planus. Now, see, what is the diagnosis here? Pityriasis rosacea. Now, what is the diagnosis here? 10 seconds in your hands, try to answer. This is a case of cellulitis. Now, what is the diagnosis here? Infectiosum. This is erythema infectium. Now, what is the diagnosis here in this case? This is a case of junctional navy. Junctional navy. This is a case of junctional navy. We already discussed about dysplastic navy. Now this is junctional navy. What is this diagnosis L50.3? What is the diagnosis? This image shows what? This is a case of dermatokeratosis. Dermatographism. This is a case of dermatographism. Okay. What is the diagnosis? Even I shared on WhatsApp group this image and asked. So try to answer in a comment box. What is this image? See. What is this? What is it? What kind of skin disorder is it? This is a case of molluscum contagiosum. Molluscum contagiosum. Okay. So yeah. What is this image? Try to answer. This next image, answer. What is it? What is the diagnosis here? This is a case of pityriasis rosea, not leprosy. And what is this? This image shows what? Thumb. This shows what? This one. What is it? This is vulgaris. Verruca vulgaris. This is a verruca vulgaris. Now, what is this diagnosis? What is the diagnosis here? This is a case of impetigo. Impetigo. Now, what is the diagnosis? 10 seconds in your hands. This image shows what? This brown. This brown. Okay. Solar lentigo. Now, what is the diagnosis? I hope you everybody seen this image. In your life you see. This is a case of capillary hemangioma. This is a capillary hemangioma. This is a case of capillary hemangioma. Now, what is the diagnosis here? This is squamous cell carcinoma. What is this here? Nevus flammus. What is the diagnosis here? Write in a comment box. This is a case of dermatosis papulosa nigra. And what is the diagnosis here? What is it? This image represents what? 10 seconds in your hands. Try to answer in the comment box. This is a case of what? This is a case of Kaposi sarcoma. Kaposi sarcoma. Okay. What is the diagnosis here? Lesser sign. What is the diagnosis? This MCQ, this image they asked in NEET PG 2019 examination. What is this? This image even I discussed in dermatology complete NEET PG previous year MCQs. So write in a comment box, what is this? This image shows what? This is an acanthosis nigricans. Acanthosis, yeah. So what is the diagnosis here? What kind of rash is it? Seen in which skin disorder? This is an autoimmune disease where we see such kind of rash. I hope everybody know. This is malar rash, or we can say butterfly rash, seen in SLE. So diagnosis is SLE. Now, okay, malar rash in lupus. What is the diagnosis here? What is the diagnosis here? 10 seconds in your hands. Try to answer. What is this? This is a case of not tinea. This is a case of granuloma annulare. Granuloma annulare. Okay. What is the diagnosis here? What is the diagnosis? Is there anybody see such patient in your practice? So what is the diagnosis? This is keloid. Yes, absolutely right. This is keloid. And this image shows what? 10 seconds in your hands. Try to answer in the comment box. This image shows what? This is a case of basal cell carcinoma. This is a case of basal cell carcinoma. Okay. What is the diagnosis here? It represents what? This is a case of melanoma. This is a case of melanoma. Okay. What is this diagnosis? This is a case of hand, leg, and mouth disease. Hand, foot, and mouth disease. Okay. What is the diagnosis here? 10 seconds in your hands. Try to answer in the comment box. I want to finish this session very fast because your exam is near. That's why I don't want to waste anybody's time. So this is a case of acne, cystic acne. Okay. What is the diagnosis here? This is a case of what? Hot tube folliculitis. This is hot tube folliculitis. Okay. What is the diagnosis? What is it? These are very, very high yield images. Before your exam, at least you have to revise so many times. What is the diagnosis in this case? This is a case of measles. This is a case of measles. And what is the diagnosis here? This is a case of what? This is a case of chicken pox. Okay. And what is the diagnosis here? This is a case of linea nigra. Okay. What is the diagnosis here? This is a case of morphia. Okay, what is the diagnosis here? What is it? This image shows herpes labialis. This is a case of herpes labialis. Okay, yeah, yeah. What is the diagnosis here in front of you? What is it? This image shows what? This is a case of scabies. This is scabies. Okay, and this is squamous cell carcinoma. Okay, this is a case of squamous cell carcinoma. Thank you for watching this video. Good day, goodbye. And if you like my videos, put like on it, and